Come in.
Hey, Fiona.
Hi.
I have a little sick kiddo. I was wondering if you could come take a look at her.
What's going on?
Well, Sophia's a 6-year-old who's been having some vomiting and diarrhea for about the past 5 days. She typically vomits about 5 to 7 times a day and has had 2 to 3 loose watery stools a day. Mom also says that she's had a fever of about 101 to 102 the last several days.
Has she given her anything for it?
Mom's tried to give her some Tylenol, but Sophia can't seem to keep it down. She's also tried to rehydrate her and get her to take a lot of fluids, but Sophia's just not interested. Mom's afraid she hasn't taken in enough to replace what she's lost.
Okay, how's she doing right now?
Well, on exam today, she's had a fever of about 104. She's a little tachycardic at 123, and then her respirations are elevated at 25. Her mucous membranes are a little bit tacky, but not dry. Can you come take a look at her?
I trust your judgment.
I'm not quite sure what to do with her, though. I don't know whether to orally rehydrate her or directly admit her to Children's.
Well, I think you can make that choice.
Well, I appreciate that you trust my judgment. I really need for you to come and take a look at her, do an examination, and let me know what you think. Do you have some time to help me?
Sure. We can go in and check.
Great, thanks.
Oh, hi, Kylie. I'm Jessica Smith from Physical Therapy, and I'm here to see Mr. Rogers today.
Hi.
Hey, is there anything new from a medical record? I saw that he was actually going to be going either to a nursing home or home here in the next day or two. Is there anything new I need to know about?
We are getting him ready to go right now, but I just got the orders to redo some of his testing to see if his pneumonia has fully cleared. So he will be going down for a chest x-ray within the next hour.
Oh, good. So I can go ahead and see him and then get my testing done before he has to go?
You know, he's been really anxious about the testing and having to, go home. So I'd really like to keep him quiet for a little while. Can you come back this afternoon?
Unfortunately, I have burn rounds this afternoon, so I really do need to get in because they're trying to decide. The case manager needs me to call her in about an hour to determine whether he can go home or to the skilled nursing, so it's kind of time sensitive.
I'm getting a page right now about another patient's medication, so I really have, this isn't a good time.
Okay, well, I'm going to go ahead and see him, and then I'll let you know what's going on. I'll try to be quick.
Okay, I've got to go.
Thank you. Oh, gosh. Seriously, another one? Inpatient pharmacy, this is Carrie.
Nurse Diane in OR 3. I'm calling for the amphotericin for Mr. Vasquez. We're waiting in the OR for it.
You know what? I'm quite certain we did that. I think I checked it. It should be in your intake drawer. Just go check there, and it's going to be there. All right? Bye. All right. Oh, God, where was I? All right, so. Inpatient pharmacy, this is Carrie.
Yeah, this is OR 3 again. Hey, where's that info? It's not in the drawer. We need it down here.
Hey, listen, I can't believe it's not in the drawer. Hold on, just a sec. Hey, Francis, the OR is, calling with complaints about amphotericin for Vasquez, I think. You know anything about it?
Yeah, that's my next one up.
Oh, crap. Okay, listen, it's coming, all right? Just hold your horses. Oh, God, what am I gonna do with this? Oh, wow. Okay.
Good morning, Mr. Forbes. Dr. Colbran. What brings you in today?
Oh, I've just had this, just killer toothache over the past weekend. I mean, I took a couple of leave to make it feel better, but you gotta take a look.
Okay. Let me quickly review your medical history here. You've mentioned here that you have heart disease, high blood pressure, history of kidney disease, and you're diabetic, and thyroid issues. What medicines are you currently taking for these?
Oh, I'm on a bunch of different medications the doctor started. Just a bunch of them. Doctor wants me to get me on a diabetic one, but we're gonna try to just do that with diet for now.
Do you think you're on medicines for high blood pressure and your heart disease? Or?
I think so. I don't know the names of all of them. There's the little yellow one you take in the morning, and the one with the really long name. You know what I'm talking about. The other ones, yeah.
Okay. Well, let's maybe start by taking a quick look at that tooth, but I most likely will want to call your physician to get some clarifying information. And you mentioned here your physician is Dr. Evans?
Yes.
Okay, I can get him on the phone and talk with him. Okay, well, let's just take a quick look. Ooh, I don't want to pull it too far. Yeah, you're really swollen here, aren't you?
Yeah.
Okay, and that tooth is pretty well gone, so I think we're probably looking at an extraction.
Oh.
So let me call and just get the clarifying information from your physician, and then we'll go from there, all right?
Thank you, Doc.
Okay, you're going to be able to hold tight for a few minutes?
Yeah.
All right.
Dr. Evans' office. How may I help you?
Good morning. This is Dr. Colbrand, a dentist in Greenwood Village. I have one of Dr. Evans' patients in the chair as emergency this morning, Mr. Ralph Forbes. I need to speak with Dr. Evans to clarify the medical diagnoses and the medications that he's on because I'm probably going to have to do a tooth extraction here.
I'm sorry, Dr. Evans is in with a patient right at the moment. Can I take a message and have her call you back?
Can you have her call me in the next few minutes? I have Mr. Forbes in the chair as we speak, and he's not in a lot of pain. He's not sure of the medications that he's taking or what they're for, and from what I can tell, he has a fairly complex medical history here. And I need to make sure that he's cardiac stable for the treatment that I'm intending to do.
As I mentioned earlier, Dr. Evans is in with a patient, but I'll put a priority on her calling you back.
Okay, thank you. I'll stay by my phone.
Okay, thanks. Bye-bye. Good morning, Dr. Evans' office. How may I help you?
Good morning. This is Dr. Colbrand again. It is imperative that I speak with Dr. Evans in order to treat our mutual patient, Mr. Ralph Forbes. Please let her know that I'm holding for her.
I think I just saw Dr. Evans come out of the patient's room. Please hold.
Oh, I don't want to do this. Is it over, please? Done.
Remember when you broke your arm? You're a good boy. You broke your arm and we waited for a long time. Are you doing okay? How about you go down to the vending machine? I'll give you some money and grab a soda. Okay? Come right back. Wouldn't the physician be here?
I can check. Actually, this might be her. Hold on just a sec.
Okay.
This is Terry.
Hi, Terry. I'm just getting ready to start an MRI with Jamie. How long before you're ready to go?
We have probably about 15 minutes. We're still waiting on the nurse to finish up.
Okay, I'll head over when once I start this case. Can you give me a call if you need me before then? All right, sounds good. See you soon.
She should.
Oh.
Hi.
Hi.
I'm ready now. So
Okay.
whenever you want to get started.
I
it's
just
fine.
got off the phone with the doctor, but I think she should be here soon. So I can go ahead and get her signed in, and we can wait for the doctor to come.
Okay.
Okay.
So, hi, how are you?
Hi, I'm good.
And who do we have here?
This is Darby.
Oh, you're in the room already?
Yeah, Carrie finished early, so I went ahead and got her signed in. Is that okay?
No, actually, it's not okay. I really need to be present for the sign-in, so we'll do it again.
Okay.
Carrie, can you look at the patient's wristband, please?
Sure, you're going to give me an arm. Okay, go ahead.
Mom, can you tell us your daughter's first and last name and her birthday, please?
Darby Miller, 6/17/2010.
Okay, Darby weighs 19 kilos. Her medical record number is 123443. She has no known drug allergies. And did you start the propofol already?
I did. I started it just now.
You know, it is really inappropriate for you to give administer anesthesia medications without me present. It's not okay for you to do the sign-in without me present. It's really not okay.
Can we talk about this later?
Mom, we'll take really good care of Darby, okay? Thanks for coming back. That was
Okay.
really helpful.
Thank you.
All right. Well,
Okay, bye, Darby.
I'll show you where you
See
can
in a
wait.
while.
We'll come find you when it's over, okay?